Good evening, Europe and the rest of the world. I know it's been a long time since I made my last video, and I'm sorry for the long pause. Yes, today I just like to make a short but kind of more spontaneous vlog or video about my current emotions and thoughts. Next week, I'm going to be hospitalized for 3 complete days because I will be having my next Lemtrada dose that will be given during 3 hospital days as an IV treatment, and I will also have some corticosteroids given as an IV as well. And due to that fact, I will leave home and be in another city for 3 days, and then I will get home and need some time to recover. But yes, the real reason for this vlog is that this whole fact that I'm now currently on a medication that is FDA approved, is thought to be the most effective MS treatment, especially for RRMS patients. And the fact that neurologists and don't acknowledge that there still is a far better drug. And Lemtrada carries so many risks, so many side effects that you wouldn't think of when you start. Oh, I feel so amazing and Lemtrada really works for everyone. And well, that's not the case if you think deeper when it comes to that drug. So far, I've heard that a number of people already have developed a secondary autoimmune disorder already after the first year of Lemtrada treatment, and most patients that are on Lemtrada, they have to go through this blood testing for at least 5 years after starting Lemtrada. And what do you think that's telling you? That's telling you about is cancer scare. That's telling you about developing the risk of developing secondary autoimmune disorders and a bunch of other scary stuff. Well, of course, there's a good thing that it will probably help you beat the monster by just reducing the amount of relapses in patients who do relapse. But there are still these people who are diagnosed with primary progressive MS and patients who already have gone into the phase of secondary progressive MS. And yet there is this smaller group of people that do progress and at the same time they have these relapses and they still progress. What about these patients? These patients need also a treatment for their MS. As far as I know, Lemtrada doesn't work for these people like HSCT does. So that's why for these many reasons I feel so frustrated now that I'm going to the hospital and I'm probably going to see several neurologists, and they're going to be asking, how are you doing? Have you realized how wonderful treatment this Lemtrada is, and you should be very, very, very grateful and very, very glad that you're doing okay with Lemtrada and stuff like that. And I don't know what I am going to say, because it's very hard for me to hide my real emotions. When I feel sad, I might cry, or I might tell you that I am sad. I need to express my feelings. Anyways, when I have these mixed feelings, I just can't tell that everything's okay, and you doctors, you know everything, and I will let you decide for me what's best for me, because you're a neurologist and you are supposed to know everything about immunology. The fact is that most neurologists don't know that much about uh, microcellular stuff and immunology and uh, hematology. That stuff is quite, that those kind of things are not that easy to comprehend if you haven't got the special education for it. And in my opinion, doctors should cooperate more between specialities, because MS is such a difficult disease to treat, and it's such a difficult thing to comprehend on a medical level. But yes, like I just said earlier, Lemtrada is not as effective as HSCT is, and the only reason I started Lemtrada was or is because HSCT couldn't be provided for me in my home country, and the waiting lists were too big for me to get HSCT at that time, and I couldn't wait for months or years to get treated, and the previous treatments I was on weren't at all effective at all, and that's why I started Lemtrada. HSCT still is the real treatment for MS, because it can help patients that have progressive form of MS, some kind of progressive form of MS. These patients really do have hope in HSCT, unlike in other MS treatments such as Lemtrada and Tizapri. I need to go to another country and pay the treatment I need for myself. That really makes me furious when I think of it. And another thing, or as an aspect, why Lemtrada and HSCT can be fully compared as treatments or effective treatments for MS. The fact is that in HSCT, most treatment protocols use moderate intensity chemotherapy, but Lemtrada treatment doesn't contain any kind of chemotherapy. Lemtrada in itself, it's not really a chemotherapy, because Lemtrada or alemtuzumab only as an monoclonal antibody agent doesn't really get into the cell by destroying it. It really modulates or modifies the cell from the outside, whereas HSCT treatment, where the chemo agents really destroy the immune system and let it rebuild itself with new cells and new healthy cells, that will give you a fresh start. But Lemtrada works differently in different people, and you never know how much how much of the bad cells, the untouched cells, will be left, how many of them. Anyways, I hope that this video was somewhat educative or informative, even though it was kind of It was, I just spoke more spontaneously and expressing these mixed feelings I have now that I'm going to the hospital. I'm going to be hospitalized and getting this drug I really don't want, but I need to have it because I need it. Supposedly I need it because I can have HSCT soon enough. But yes, I really need to take this drug because so far I haven't got my accurate HSCT in Moscow, so there's no other option but to wait until that. But of course, I'm not telling you that if you are extremely newly diagnosed with MS and you haven't had any kind of permanent damage from MS relapses. Of course, it's good that you start Lemtrada immediately, because if you won't have any kind of relapsing due to being on Lemtrada, the possibilities of having later disability from turning into secondary progressive, the chances are quite low. But for people who already have had some damage even before, some nerve damage that can be reversed, these people should be advised to go seek HSCT instead of just waiting and wishing that the miracle treatment will just fall from the skies. Lemtrada unfortunately is not able to help patients who do progress. And for myself, being a 2 on the EDS scale is severe enough to go seek HSCT, because my history with MS is only 4 years and I yet have the EDCC of 2, and I think that is quite bad, because if I have now EDSS of 2.0, the odds that when I really will hit the secondary progressive form of MS and stage, the odds that my EDCC score will go up. It will probably go up and my disability will increase, and that is something that we really don't want. And the real thing you can do is to prevent this from happening by choosing HSCT, and I really, guys, need your help. But for the money I have got through donations, I am really thankful for that money, but I really would appreciate some extra donations, any kind of donations coming from you guys. So now I think it's time to thank you guys very much for watching this video, and I hope with this video you gained some more knowledge about my progress or negative progress with MS and my journey towards HSCT, which is probably, hopefully approaching, although I haven't got an accurate date for HSCT in Moscow. But yes, I hope that this video wasn't too messy or too confusing or too spontaneous to be spontaneous. I hope you guys donate if you haven't donated yet, and any money is good enough for me. No matter what, I'm so thankful for you haven't given to watch this video, or even better, to donate for a good cause that is going to be a lifesaver for me. Because let's not forget that MS is a progressive disease. So, thank you. Bye-bye.